Everyone, and welcome to this audio podcast. This audio podcast is part of as part of the audio podcast series, the Laboratorial News. This audio podcast is part of the LabZtorm. This audio podcast is part of the Crowell Boulder, and this audio podcast is part of a Storm Robotics production. In this audio podcast, basis in regard to the intro to peer review and published works from 2020. Uh, and so uh, and so in regard to the intro, then patient access or healthcare service user access to information support to supplement understanding of laboratory and test parameter faces challenges because of medical and scientific terminology or terminologies. Such terminology is sort of everyday language for health professionals or healthcare service providers communicating with each other. But when professionals or healthcare professionals, healthcare service providers communicate with healthcare service users, the medical jargon can become overwhelming. Such constraints can give rise to the gaps in appropriate advice, information, and education in several aspects of health and disease. The challenges have also led to the investigation of newer and effective or efficient ways of approaching educational information support for patients and for patients across various parts of healthcare service provision. In addition, there has been a rise and an increase in support groups online, for example, through social media, through social media such as Facebook and blogs, for example, where healthcare service users healthcare service users and carers, for example, share sort of lived experiences understanding to help increase shared decision making. It is against this sort of backdrop that there have been calls for use of tech in healthcare to improve access to our services, to enable better integration and to the delivery of care more more applicably. So in the United Kingdom, for example, healthcare service providers are being or have been encouraged to use tech in several ways, including sort of moving away from a paper to digital healthcare records and offering services through apps and web portals. The new digital offerings range from administrative tasks of in around service user healthcare service user sort of registrations, laboratory investigations and tests, booking appointments, and sort of repeat ordering of medicines to provision of clinical services, such as video consultations and and reviews. Similarly, patients or healthcare service users are being or have been exposed to and are interacting with a range of tech, including web portals again, including web portals and sort of social media and apps to assess and manage healthcare to manage health risks and healthcare. This has perhaps become more especially important and true for healthcare service users with long-standing or long-term conditions such as chronic kidney disease or CKD. That draws this audio podcast to a close. This audio podcast as part of a Laboratorial news. This audio podcast is as part of a LTCs. This is an audio podcast as part of a Crowell Broader, and this audio podcast as part of a Storm Robotics production.